prothrombin time and activated partial thromboplastin time. Prothrombin time is used to determine the activity of extrinsic coagulation factors 2, 5, 7, and 10. The PT test is important in the induction and monitoring of oral anticoagulant therapy. It is an important screening test in diagnosing genetically caused deficiencies in coagulation factors of the extrinsic system. It is used to diagnose acquired deficiencies in coagulation factors and also to check the synthesis performance of liver in hepatic diseases. Activated partial thromboplastin time, that is APTT. This is used to evaluate coagulation abnormalities in the intrinsic pathway and also to detect severe functional deficiencies in factors 2, 5, 10, or fibrinogen. Sample collection, processing, storage, and transportation for coagulation studies is very important to arrive at a correct result. Collection. The blood is drawn via venipuncture. The correct technique of venipuncture is discussed in detail in the section on phlebotomy. For coagulation studies, avoid using tourniquet or apply it for less than 1 minute. In the order of sample draw, coagulation tests must come right after culture tube draw. Contamination by drawing clotting tubes before coagulation tubes should be avoided. Collection from lines previously flushed with heparin should be avoided. Sample tube. Citrate tubes, blue top, 1 part 3.2% sodium citrate solution with 9 parts venous blood is recommended. Mix the citrate solution and blood by gentle inversion. Follow the manufacturer's instructions for the number of inversions. The sodium citrate in the tubes is in the liquid form, so care must be taken that the liquid is not lost by careless handling of the tubes. Note: any microclot formation will consume the analyte you are looking for, giving spuriously prolonged results. If syringes are used, it is important that the blood is transferred to the appropriate volume of anticoagulant within 1 minute of draw, avoiding the formation of foam. Small volume syringes are recommended to avoid clotting during the collection process. Use of discard tubes. The hypothesis that discard tubes are to be used to avoid contamination with tissue thromboplastin is not validated. However, while using a winged collection set, if the coagulation tube is the first tube drawn, use a discard tube first. This will ensure the appropriate volume in the PT tube, eliminating the dead space of the winged collection set in the discard tube. The discard tube must be a non-additive tube.
Needle gauge. A 19 to 21 gauge needle is recommended by CLSI to avoid hemolysis. 25 gauge or smaller may induce hemolysis or activate the platelets, leading to erroneous results. This is very much more of a requirement while using winged sets due to their longer path between the vein and the anticoagulant.
All reagents and test samples shall be incubated at 37 degrees Celsius immediately prior to testing to ensure reaction temperature. Water baths must be temperature controlled. timers shall be checked for accuracy at least annually. Carefully examine the sample for clots by gentle inversion and observation. Preparation of platelet poor plasma, that is PPP.
To obtain a plasma sample, centrifuge the blood specimen at 1500 G to 2000 G, that is approximately 4000 rpm, for 15 minutes at room temperature to achieve a platelet count of less than 10,000 per microliter. This is as per NABL Standard 112.
The counts must be verified on randomly selected specimens once in 6 months or following a major repair on the centrifuge which requires recalibration. Use a swing-out bucket rotor to minimize the contamination of the plasma with platelets and other blood cells. Double centrifugation of the sample may be performed to ensure that the sample is platelet poor. This can be achieved by transferring the plasma following the initial centrifugation process to a non-activating plastic centrifuge tube using a plastic pipette, then centrifuging the sample for an additional 10 minutes.
Note: while transferring the plasma from the primary tube, separate the PPP without disturbing the buffy coat. And when aliquoting to a secondary tube, take care to not include the residual platelets that may have collected at the bottom of the centrifuge tube.
The presence of visible hemolysis, as evidenced by a pink to red tinge to the plasma, should be noted. Lysis of red blood cells and the resultant release of intracellular or membrane components may cause clotting factor activation. This activation of coagulation factors may impact clotting time results, whether using an optical or mechanical endpoint detection.
Short-term storage of plasma for coagulation testing. Coagulation tests must be performed within 4 hours of collection. If longer delay is expected, plasma should be made platelet-free and kept frozen until the test can be performed. That is, at minus 20 degrees centigrade for up to 1 week and at minus 80 degrees centigrade for up to 1 year.
For the whole blood samples maintained at room temperature, avoid mechanical agitation during the storage that may cause spurious elevation of the PT or INR through an unknown mechanism. Sample integrity is maintained at room temperature if samples are centrifuged immediately after blood collection. Storage at refrigerated temperature 2 degrees Celsius to 8 degrees Celsius is not recommended, as it may result in cold activation of factor 7 and therefore alter the PT results. Specimens for routine APT assays from non-heparinized patients can be maintained uncentrifuged with plasma remaining on the top of the cells in an unopened tube kept at room temperature for up to 4 hours from time of specimen collection.
Placing whole blood specimens directly on ice or in an ice water bath simulates refrigeration and is also not recommended.
Quality controlled. A control, normal and abnormal, should be tested with each batch. Each control must be used according to the manufacturer's directions. Control values and limits will vary with the brand used. Calibration. The centrifuge used for PPP should be calibrated annually. The pipettes need calibration annually. The water bath used for manual methods should be calibrated annually. Ideally, multiple areas of the water bath should be calibrated for the operating temperature. The timer should be calibrated every year. In automated methods, temperature, timer, and optical, mechanical, or other mechanism of testing should be calibrated. ISI, INR, and MNPT are three numbers that are very important in the standardization of PT results. This is because the thromboplastin reagent used for PT estimation is very variable in its strength. PT is a test that needs continuity. A patient on anticoagulants will need repeated estimations of PT. So, the variability within the same lab and between labs has to be minimized. What is an ideal thromboplastin? It will be the same as the standard PT reagent established by WHO. Since in real practice this is not possible, two corrective steps are undertaken. 1. Each batch of thromboplastin reagent is calibrated against the standard PT reagent established by the WHO, and this value is called the ISI or the International Sensitivity Index. The ISI value has to be assigned by the manufacturer for each lot of reagent. The lower the ISI, the more sensitive the reagent. ISI value of 1.8 to 2.4 has low sensitivity. ISI value of 1.4 to 1.8 will have average sensitivity. An ISI 1.0 to 1.4 will have high sensitivity. Always understand the ISI value whenever you get a new lot of PT reagent. Search for the ISI value on the kit insert. For the kit used in this demonstration, the value is 1.6. Some kits can specify multiple ISI values. This is because the reagent needs to be calibrated for different equipments. 2. INR or International Normalized Ratio. Every lot of thromboplastin is also required to have a population mean derived from the normal population. For this, an estimation of MNPT or mean normal prothrombin time is required. A laboratory can estimate the MNPT from a minimum of 20 healthy individuals with a relatively equal mix of both sexes over a range of age groups. People on anticoagulants, pregnant women, people with known bleeding tendencies should be avoided. Estimation of a geometric mean is to be preferred to the arithmetic mean. MNPT samples must be fresh. The mean of a laboratory normal control is not an acceptable substitute for the MNPT since control samples may differ excessively from each other, particularly in the case of less responsive